Hello, my name is Dr. Caroline Abisogun, but you can call me Caroline, everybody does. I'm one of the specialty anesthetic doctors in Croydon University Hospital, and I'm here to talk to you briefly about epidurals and how they work. When you come into our hospital in labor and you'd need an epidural, the midwife will give you an information card which you can read and tells you briefly what epidurals are about. The anaesthetist is free to answer any questions you might have about the epidural. Once we're ready, the anaesthetist comes in to set up your epidural. You will have an intravenous cannula or maybe a drip running before your epidural is put in. And while the epidural is being put in, whenever you have a contraction, it's quite important that you let the anaesthetist know you're having a contraction. They usually will wait for you for the contraction to pass while we continue, as it's important that you sit as still as you can. It usually takes between 20 minutes and 30 minutes to put the epidural in, and it takes about 20 to 30 minutes also for it to start working properly. Sometimes some epidurals don't work fully and they need to be adjusted or replaced. Epidurals are a very good form of pain relief during labor. They usually provide excellent pain relief when they're working very well. But sometimes for people who have difficulty sitting still because they're in a lot of pain, a few anesthetists will put a spinal anesthetic in, which is similar but it's a one-shot injection. The dose of the anesthetic we use for epidurals can be increased or decreased according to personal preference. And in general, the epidurals do not affect your baby. If you need to have a cesarean section at some point, we can top your epidural up. So what we do is we come into the room with all our things. We tend to sit you up, and occasionally you may be laid down on your side. The anaesthetist will then spray really cold spray on your back, which keeps your back nice and sterile. And then they get prepped up wearing a gown, gloves, and a hat. While you're in the sitting position, you might have a stool to rest your feet on, which usually will stabilize you, and you'll be given a pillow to hug and put in the epidural position. The anaesthetist will then inject some local anesthetic into your back to numb it for the epidural insertion. The local anesthetic stings, but only for a very short time. Once your back is numb, the epidural process is started, and some people get a very short transient electric shock or tingling in their legs at the point of epidural insertion. At this point, we put in some local anesthetic to check that the epidural is in the right place, and we tend to call it a test dose. The midwife will then attach a blood pressure cuff to you, and your blood pressure will be taken, and you'll be taken regularly thereafter for about half an hour. This is because the epidural can drop your blood pressure, and we'll like to know because it's easily treated. The epidural may also at this point make you feel sick or nauseous, and usually that disappears once you have some fluids running in your IV cannula. Once we're sure the epidural is in the right place, you're then connected to an epidural pump, and the anaesthetist will teach you how to use the pump. Some of the problems we have with the epidurals include repeated tuck-ups causing your legs to feel really heavy and increases the risk that you might need to have your baby taken out with the help of a vacuum or the forceps. Sometimes the epidural slows down the second stage of your labor. We have your IV drip running because the epidural, like I said, can lower your blood pressure. And occasionally, a few people might feel a bit itchy, and some people's temperature may go up. All these things we anticipate, and we have things to fix them. Usually, the site where you have your epidural inserted might hurt a little bit, kind of like having an IV cannula in your hand. And it hurts for a day or two, but usually disappears afterwards. Epidurals in themselves do not cause backache. Epidurals are very good forms of pain relief in labor, and once inserted can be used throughout labor and even sometimes after labor in case you have a cesarean section as pain relief prior to their removal. So we'll be looking forward to seeing you in case you need an epidural, and we hope you all have a happy, comfortable labor. Thank you.